The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, how are you today? My name is Nick Vusick, and we're going to take you through a quick webinar on the HHS proposed child care rules. We're going to talk about training today and what new requirements and measures are included in the proposed rule. As I said, my name is Nick Vusick. I handle government affairs here at Child Care Aware of America. Throughout the webinar, if you have any questions, you'll see a question box on your screen. So just go ahead and feel free to type them in, and we'll reserve some time at the end of the webinar to get to as many of them as we can. So let's start off with what is the Child Care and Development Block Grant. CCDBG, as it's more commonly referred to, is a $5 billion block grant program that provides funding to states, territory, and tribes. It is the primary federal funding source devoted to providing access to child care services and improving the quality of child care. It was originally started in 1990. It was passed by Congress in 1990, and then it was reauthorized as part of welfare reform in 1996. And unfortunately, since 1996, there haven't been any additional reauthorizations. So what was legislated in 1996 has been the law of the land since. So what is this proposed rule? It was released in May of 2013 by Department of Health and Human Services Secretary Kathleen Sebelius. It is part of the administration's plan for early childhood education, which you may have heard something about regarding preschool for all and home visiting expansion and child care and early Head Start partnerships. If you'd like to read more about the full proposed rule, it's available at this link below, and we'll make sure you have the slides so you have all the links. And then it opened for public comment, and there is a 75-day public comment period, which ends August 5th. So we're getting into about a month of time left for you to go out there and comment and make sure your voice is heard on any of your concerns, or if you even just want to make sure they know that you appreciate that these rules were put forth, you can do that as well. So before we get into kind of what's in the training requirements, the first thing we kind of wanted to take you through is, what is this in the grand scheme of things? How does this work? What's the federal rulemaking process generally? The first thing that happens is a federal agency looks to see if there's a need that can be met through the regulatory process, and if it's determined as necessary, the agency goes ahead and drafts what's called a proposed rule. Throughout the drafting process, they'll research, what's out there now. They'll usually talk with different stakeholders and find out what they think is important, what needs to be part of it. Sometimes they'll hold meetings and hearings and try to figure out the best way to make sure all of the any proposed changes impact where the most need is necessary. Next, the federal agency then publishes a rule to the Federal Register. At this point, once the rule is published, the public then is able to comment on the proposed rule for a set period of time, which typically ranges from 30 to 90 days. In this specific instance, as I mentioned, it's open for 75 days. Once the comment period ends, what happens next is one of the more interesting parts. The federal agency then reviews the comment and revises the rule where necessary. So if they have a section where they see a lot of not negative comments, but constructive comments on parts that might need clarified, or issues that may need resolved for certain stakeholders, they have the option to go back and revise that part of their proposed rule. At this point, they then publish what's called the final rule, and it goes into the Federal Register. At this point, they submit the final rule to Congress and the Government Accountability Office, GAO, for review, which could take up to 60 days. And unless Congress has any significant conflicts with the bill or with the proposed rule, it will most likely be implemented by the federal agency at the end of it. So that was a little bit of the federal rulemaking process in a nutshell. So let's get into the specifics of this proposed rule from HHS. So some of the highlights of the proposed rule are requiring providers to undergo comprehensive background checks, including federal and state fingerprints and checks of the sex offender registry and the child abuse registry. There are minimum training requirements, which we will talk more about, which include safe sleep practices and first aid and practices to prevent shaken baby syndrome, an emergency evacuation or shelter-in-place planning. There's planning for disaster and emergency responses in child care settings, which is a new proposed change. One of the big ones is raising the eligibility period to 12 months, helping to ensure continuity of care for children and families. Enhanced resources to assist families in finding quality child care in their area, including consumer education websites with comparable quality indicators, a consumer complaint hotline, and better coordination with other services impacting families and children. And then, of course, there's also a inspection component, a monitoring component, which includes an initial inspection before licensing, and then one unannounced inspection annually. So I think it's important to first look at where, what are the current training requirements in the Child Care and Development Block Grant. Currently, the Child Care and Development Block Grant under current law requires no minimum training for child care providers. Every week, about 2.3 million individuals earn a living caring for and educating children younger than age 5 in the United States. About 1.2 million are providing care in licensed settings such as child care centers and family child care homes. The remaining 1.1 million caregivers are paid relatives, friends, or neighbors. Child care providers have an enormous impact on children's development. Research has shown that better trained providers lead to higher quality care and more positive outcomes for children. A provider's skill level helps determine whether children in care are safe and have the early learning experience they need to succeed in school. Training is important. I mean, it really is a key factor. Initial training helps ensure providers have a base of knowledge about how children develop before beginning to work with them. It also acquaints them with basic health and safety skills such as first aid and CPR. Annual training supports initial learning and helps providers improve their skills, deepen their understanding about how children learn, and stay current on changes in health and safety practices. The number of required annual training hours for the child care workforce in most states is extremely low and insufficient to ensure individuals have the knowledge and skills needed to care for and educate young children. 21 states require fewer than 15 hours of annual training. According to a 2010 nationwide poll of parents that Child Care Aware of America conducted, most parents' perceptions about child care licensing standards far exceed the reality of government policies. For example, the majority of parents believe child care providers are required to have training in CPR or first aid, basic health and safety practice, and in child development. Some of the findings from that poll were that 94% of parents polled support requiring paid individuals in the child care workforce to have basic training in health and safety practices and child development before working with children. In that poll, we also found that 88% of parents support an annual training requirement for providers. So now into the good stuff. What's in the proposed rule? What changes would be made to improve the health and safety of children and families receiving child care assistance? The proposed rule would improve health and safety protections for children receiving CCDF assistance by specifying minimum state health and safety standards for their child care providers, including pre-inspection for compliance with state and local fire, health and building codes, criminal background checks, and most importantly, pre-service training in specific areas such as first aid and CPR. The proposed rule requires states to take steps to improve the monitoring of child care providers who receive CCDF to care for children by conducting unannounced on-site visits to CCDF providers and set some basic minimum health and safety requirements for those providers to undergo as part of their training. We believe it's important to establish a minimum baseline for pre-service and orientation training that applies uniformly across all providers serving children receiving federal child care assistance. This proposed rule change would ensure that all child care providers responsible for the health and safety of children have received specific and basic training that matches up with their professional roles. The proposed rule adds a list of minimum health and safety pre-service and orientation training appropriate to the provider setting and ages of children served. That list includes first aid and CPR training, medication administration policies and practices, poison prevention and safety, safe sleep practices including sudden infant death syndrome, SIDS, prevention, shaken baby syndrome, and abusive head trauma prevention, age-appropriate nutrition, feeding, including support for breastfeeding and physical activity, procedures for preventing the spread of infectious disease, including sanitary methods and safe handling of foods, recognition and reporting of suspected child abuse and neglect, emergency preparedness planning and response procedures, management of common childhood illnesses, including food intolerances and allergies, transportation and child passenger safety, caring for children with special health needs, mental health needs, and developmental disabilities in compliance with the Americans with Disabilities Act, child development, including knowledge of developmental stages and milestones of all developmental domains appropriate for the ages of children receiving services. This proposed list represents the most immediate needs related to basic health and safety for all children receiving federal child care assistance. However, states are encouraged to develop a comprehensive training program that also covers additional areas such as program design, worker safety, and child development needs. In addition, training requirements should be appropriate to the provider setting and the ages of children served. For example, training on SIDS, sudden infant death syndrome, is only necessary if the program cares for infants. If providers are caring for children of different ages, training in first aid and CPR should include elements which take into account that practices differ for infants versus school-age children. Some more issues with the, or not issues, but factors with the proposed rule is the cost will vary by state. Many states already have these provisions in place. For those requirements that would be new costs, states have flexibility on how they allocate expenses. Some states use CCDF funds to pay for all or part of background checks, or all in part of inspections, or all in part of training. States have, maximum flexibility with training, as some offer free or subsidized training to minimize the burden on providers. So what does this say? These set a minimum baseline and allow states to have flexibility in designing the system and the delivery of training. A lot of states already partner with third parties to make sure that the people who work with providers most closely are providing these trainings and at cost. So if your state already matches most of these lists or a good portion of the list and has minimum training hours, you'll be ahead of the game. And the fact is, there's a portion of states that have these in place. So bringing all states up to it will not be a gigantic lift, if you will. Another important thing to remember is these rules don't set a requirement for format. So how is the training done? Is it online, in person? Is it technical assistance? Is it home visiting? They leave that open to states to make sure states have maximum flexibility in meeting how they already do it with what minimum baseline goals are required now, or would be required. And lastly, as I mentioned, there's flexibility for states to contract with third-party agencies to provide training. So many states, for example, work with resource and referral agencies in those states who provide the training. This is something we've heard from a lot of our members, has been something that they feel they do very well, and they work with the state very well. States will be encouraged to use existing resources and infrastructure to provide these trainings, as well as existing networks to make sure the right people are getting the training. So the last thing I'd like to talk about with training is where is HHS seeking specific comments on different issues. HHS is specifically seeking comments on what the appropriate phase-in period for providers already serving CCDF children to meet health and safety requirements, and whether there should be a minimum number of hours required for pre-service and ongoing hours of training. So, as you may have heard us recommend in the past, we still recommend that providers undergo 40 hours of initial training and then 24 hours of annual training, which can include any of the minimum training, basic health and safety requirements mentioned in the proposed rule. To comment, you would just need to go to this link and make sure you follow the instructions provided. And one page that I think would be really helpful to you if you have questions or if you're looking for more information is our resources page. So what you see here is we have an entire page dedicated to the proposed rule from HHS, which is this top link. The second link, we did a one-pager on training, which should help, see possibly where the nation is, give a bigger picture of what's going on and what we recommend. If you'd like to see more information about the rule from the Administration on Children and Family, you can go to this link. To comment on the rule, you would follow the next link. Any frequently asked questions, so, what is a rule? What is a federal rule? Why is this process important? Why should I comment? What does this do? ACF has provided a pretty good frequently asked questions sheet. And lastly, you can read ACF's blog on the release of this proposed rule, or Child Care Aware's policy blog on this proposed rule. So at this point, I'm going to open it up for questions. So if you have any questions, please type them in the box, and I will go through them. Oh, this is a great question, and yes, will we receive a copy of the presentation in order to get the links? Yes, absolutely. These slides, not only will this recording of the webinar be online, if you wanted to share it, but the slides will be posted as a PDF with working links, so you can just go there, download them, and have all of the resources and links to everything that's there. Well, this is a really great question. Does the rulemaking process make it more likely that the changes will happen? How much influence does Congress have on the final decision? This is a big question. This is one we're hearing from a lot of members. And with the way the federal rulemaking process works is, I would say there's a pretty good chance, as long as there's a lot of positive comments being driven to the rule, that this will go through. So what will happen, as I mentioned, is it will be commented on. They'll review the comments. If the comments provide enough momentum for the administration to move forward, and there's not enough, and there's not overwhelming negative comments, what you will see is this most likely moving forward. We've worked very closely with the Administration on Children and Families and the Office of Child Care, and we are confident in their leadership and their dedication to this as a important issue that they're going to move forward on. As far as Congress goes and their influence on the final decision, this is something that's come up multiple times in Congress, and what has happened in the past is there would have to be a significant outcry to have Congress step in, and even when there is a significant outcry, it hasn't always been the case. So what you've seen, and I'm just using this as an example, last year there was an outcry about the TANF welfare work waivers rule that was posted, but there wasn't enough momentum in Congress to put a halt on it. So on something that you see like this that does have bipartisan support in Congress, as you saw with the reauthorization bill, there doesn't seem to be a lot of momentum against moving forward with this. A lot of questions, let's see. These slides, just going back to it, will be made available on the Lunch and Learn webinar page, which can be found on our website. Under policy, it's in that drop-down. You'll see it says policy webinars, and it will be under there. Let's see. All right, so do the new rules require that the individuals who train child care providers on these health and safety practices actually have the appropriate training and credentials? For example, are they health care providers with the expertise in early learning settings? That is a tremendous question, and something that has been raised in D.C. and across many of our member states. And what we have been told is that there will be, most states already have certification process for the trainers, providing trainers, the people who will be doing the training. So if they're contracting with, say, a resource and referral agency, they would have to go through either an accreditation process or a certification process that they are qualified to handle this training. And that's typically part of the state contract and grant process. So when a state decides this R&R or this training academy is going to lead the training, it's part of the requirements and eligibility behind it. Let's see. All right, this is a perfect question. If I have training suggestions, how do I tell HHS? I know a lot of you have probably dealt with training in many levels, either being on the receiving end of it as providers, or providing the trainings yourself to providers, or working with agencies and states who provide the training. If you have, HHS is looking specifically for comments from people who have worked with this on ground level for anything from implementation to best practices to wording. And what would really be helpful is to go to where it says to comment and talk and write down your suggestions. You know, they're looking for input from the field to the best ways they can implement and move forward with this. So any suggestions, any recommendations you have, they are looking for them, they're asking for them. So please make sure you go and comment. If I can suggest anything, that would be something that would be definitely recommended. This is another great question. How do we explain the reason for 40 hours of orientation and 24 hours of annual training as opposed to lesser numbers for each? Are 40 hours and 24 hours, how are those numbers selected? We'd actually worked with researchers in the field who looked at what they believe would be required to bridge the gap to make sure that child care providers have at least a baseline minimum understanding and comprehension of what's going to be necessary to take care of children. Just for an example, how we came to those numbers, the American Red Cross recommends that every provider undergoes 6 hours of CPR training annually. So if you just look at the CPR portion of that, you're knocking that off right off the bat. So if you take that, that's 34 hours on the rest of it initially, or it's 1/4 of it annually. So, I mean, that's a pretty big portion of that just dedicated to that. So we talked with members, we've talked with, researchers and analysts in the field to come up with what we feel would be at least the baseline number to help providers get to that bare minimum. And let's see, I think we have time for one more question. So my state already has training requirements. How will this change and when? That is something that, as I said with a lot of other things, has been on the has been asked from a lot of states, because a lot of states do have different training requirements. They may not be exactly in line with what was presented here today, but if the final rule is implemented and enacted, it will be part of the state plans in 2016, 2017, and it will be part of the fiscal year 2015 budget, which means states would have a few years to come into compliance with it. And as we mentioned, most states already do some sort of training requirements, even if it isn't, a significant portion of hours or basic health and safety. So, each state will be different in how the rules impact them. We do provide reference, if you would like, on our training page. If you go to policy and look up training, or public policy issues, and go to training, you can find statistics for what your state already does and what ways they can, how they may be impacted by these rules. Well, I appreciate your participation in our webinar, our Lunch and Learn webinar today. If you have any questions, please feel free to email me. You will receive a link to where you can find the recorded version of this webinar, and you'll also be provided with somewhere to go to find the slides online. Well, I thank you, and I hope you have a nice Thursday.